way the system thinks about the role of community pharmacy, that as far as I'm concerned, you are a core part of the NHS family.
I think the COVID pandemic has highlighted the opportunity to bring that face-to-face and technology together, so bringing people together, not forcing them apart.
The way to get engaged is to run towards it and say, look, we can help you with that. We will do that. We have answers to that. We have prototypes for that.
In short, the public thinks that pharmacists have played a critical role during COVID-19, with 89% seeing their role during the crisis as essential. As many as 55% of people have visited pharmacy for medicines during lockdown. 55%. I mean, that's a pretty hefty contribution, and that is exactly the basis on which we should have future engagement with NHS England, with Public Health England, and with Departments of Health and ministers.
I see there's opportunity because there's more services that we want to get down to the closer into communities. And we need to make sure that as we deliver those, because there's better value for money to be got from delivering those through pharmacies, therefore everybody can win out of more use of community pharmacy.
Those regulatory principles which sit right at the heart of our standards for pharmacies and our inspection work to illustrate how they really bring home the important role of risk assessment in keeping staff safe, but also in upholding and achieving the regulatory standards.
Because you are our eyes and ears on the ground, and you understand the patients who we serve.
Over 60% of respondents said that they had their mental health impacted by work or that they needed support with stress at work. 80% of people were at high or very high risk of burnout. And over 50% of people who responded, this is all people working in pharmacy, were considering a career